It's a delight and privilege to catch up with Elizabeth Smith, who's the co-founder and CEO of EYElliance. Um, Elizabeth has got a wealth of experience on working with a whole range of sectors. So prior to what she's doing right now with EYElliance, she worked with Vision Spring. She also worked with the UN. She worked on projects with the Ford Foundation. She's been involved with the music industry, and you've done quite a bit. You worked in many parts of the world, especially in Africa. You've done a whole range of things. So thank you so much for taking the time and talking to us.
Of course. Thank you for having me. I'm excited to be here.
So Liz, I'm just wondering, what is EYElliance and how does it support the need for a pair of glasses? So somebody who's underprivileged wants a pair of glasses. So how does EYElliance really work?
Yeah, absolutely. Well, EYElliance was launched in 2015. We are a multi-sector coalition. And so that means we work with and through partners and our 50 member organizations to close the global gap in access to eyeglasses. We make the case for action and investment in uncorrected refractive error, and we elevate the issue area on the global development agenda. EYElliance also works to mobilize new resources for the sector to solve the problem at scale. And our work directly contributed to new resources from USAID being allocated to low-cost eyeglasses initiatives. And the new funds now total $9.5 million over the course of 3 years. Now, we understand that's just a start, but we're also very proud of that. At country level, our work is focused on demonstrating that governments will integrate proven models of eyeglasses delivery. And those are the models and solutions that NGOs have pioneered. And we believe that those governments will integrate those models into national plans and systems. And we're doing this in Liberia. And one recent win there is that the Ministry of Health has included the training of community health workers to both screen and dispense reading glasses in the next training package and national policy through the year 2030. So we're really excited about that. And in Latin America, we are accelerating the regional scale of an inclusive business model that was pioneered in Mexico and profitably reaching low and middle income customers. So it's in these ways that we hope to demonstrate to large funders and development finance that these scaling pathways can absorb significant resources.
Thank you so much. And just wondering, based on your experience, especially working, in Liberia and other parts of Africa, what are the major barriers for someone, with regard to getting a pair of glasses? Why is it so difficult?
Yeah, well, it's a great question. At the community level, at the patient level, the barriers are pretty basic. It's limited access to eyeglasses. There are few affordable options. A lack of awareness that vision problems are often easily corrected or addressed. And that's pretty, as you well know, that's pretty standard across low and middle income countries, those three barriers. At the global level, it's not too different when we think about solving this problem on a global level. We're having trouble addressing the unmet need due to lack of resources committed to the problem, a lack of eye health professionals who can perform eye exams and determine prescriptions, and also a lack of awareness about the magnitude of the market opportunity. And specifically, governments in low and middle income countries are, for the most part, not committing enough resources to the ministry budgets to meet the need. And similarly, despite the potential for privately owned optical shops to meet a significant portion of this need, the investment in inclusive optical is nascent at best, especially when you consider the amount of development finance invested in off-grid solar opportunities. So in terms of the philanthropy being committed to solving this problem, the most recent data we have is from the year 2015. And in 2015, 4 cents per person, that's less than a US dollar, was spent on creating access to eyeglasses. Mm. And when you compare this to US $3.28 per person for clean water and sanitation, or the $11.22 spent per person to eradicate malaria, it's clearly unacceptable that 4 cents per person to address uncorrected refractive error is unacceptable. And then on the global level, the shortage of eye health professionals with the core competencies to perform comprehensive eye exams and determine prescriptions is a real challenge. Progress is being made in terms of task shifting to deliver basic services like vision screenings conducted by teachers and community health workers. But of course, this really needs to be scaled up globally to support the work.
And maybe I'll just touch on one of the issues you just did raise about the lack of skilled human resources. And I mean, that's a huge barrier, all through the world. And I was just wondering, have you come across innovative approaches that people have taken in dealing with this?
Yeah, I think so. I think NGOs are clearly well aware of this problem. As you mentioned, it's one of the biggest barriers, particularly in sub-Saharan Africa, but really all over the world. EYElliance does not work specifically on training eye health professionals. As I mentioned, our focus is on task shifting primarily, and advocating for ministries to recognize multiple cadres of eye health professionals. I can report that in Liberia, there has been a 60% increase in the number of eye health professionals trained since 2018. But unfortunately, many countries that are lacking eye health professionals have followed the lead of the global north and tend to promote the recognition of 4-year degrees. And as I mentioned, many NGOs are advocating for shorter training programs that would be a more efficient way to increase the number of skilled eye professionals, to give us even a chance of a hope of addressing the leading cause of vision impairment, which of course is refractive error. And every country has a different approach to who is permitted to prescribe eyeglasses. So I do think there's an opportunity for international bodies like the International Council for Ophthalmology, the World Council on Optometry, and the WHO to come together and align and set forth recommendations for low and middle income countries. But yeah, it's a real big challenge that we're facing.
And my very last question is, what's been your experience working with governments? How do you get them to, one, understand, second is get excited, and also often they have the best infrastructure, both in terms of, built infrastructure as well as HR. How do you get them to more involved? What's been your experience?
Yeah, we think governments are a huge part of the piece that's going to help us solve this problem. We're relatively new to this, and so I just want to point out there have been NGOs who've been working on this for many, many years, and we've really learned from their experience and listened intently to what they think works. In Liberia, EYElliance had a really interesting opportunity because we were introduced to the sitting president, and having the opportunity to make the case at the head of state level translated into near immediate action from the ministers. And I think that's unusual. In conversations I had with both the Ministry of Health and the Ministry of Education in the weeks that followed that initial meeting with the president, I subsequently learned that the Minister of Education, who wore glasses, he had a terrible time with his vision as a child, and it took him years before he obtained properly prescribed glasses. And of course, the Ministry of Health was well aware of the problem. And in this particular situation, we did have sufficient evidence to make the case, and also a basic understanding of where to start with schools and community health workers, while the Ministry of Health continued to build capacity at public health facilities. So it's interesting that you asked this question, because EYElliance is also collaborating with the Clinton Health Access Initiative on catalyzing the global scale of school eye health. And we've learned from them, Clinton Health Access Initiative works in ministries of health at the country level. They have offices literally in the ministries of health. And what we've learned from them is that there's really strong pull from the government for this work, particularly to transition from district or province level interventions to national school eye health. And as we've talked about, the challenge will be developing a plan that takes into account the gaps in capacity with a clear understanding of how to fill those gaps in both the near and the long term. And of course, as always, mobilizing resources is always a challenge, as we've talked about. With School Eye Health, there may be an interesting opportunity to gain joint commitments from ministries of health and education. And what we've learned is that in low and middle income countries, there are development partners like the Global Partnership for Education and the World Bank, who often fund school health plans or inclusive education plans, while the ministry tends to support teacher salaries. So I mentioned earlier also how the Ministry of Health in Liberia has included training community health workers to screen and dispense reading glasses. They've included that into the national package and policy. And so in practice, what this means is that they will be assuming, the Ministry of Health, will be assuming a significant portion of the cost associated with that intervention while it operates at national scale. And I think this is really encouraging, both in terms of the potential for joint commitments between the ministries, as well as this evidence that the Ministry of Health is starting to assume in this particular incident with community health workers, is starting to assume a lot of those costs associated with screenings and dispensing reading glasses. And I think that's encouraging when we start thinking about how to unlock government resources to support this work.
Thank you so much, Liz. Thanks for taking the time, and congratulations on all the excellent work you're doing out there. Thank you again.
Thanks so much. This was great.